Yes. So to introduce you about Alborz Diagnostic Research and Development Unit. So we are offering the clinical and diagnostic test for a wide variety of genetic tests. And we have research services and different kinds of training and continuous education programs. And you hello, good.
Your voice is gone, Dr. Noor.
Good evening, all the participants. Today, I welcome you all to the webinar talk of becoming a genetic counselors, being organized by Alborz Diagnostic. As you all know, the genetic counseling is a very important profession in the field of molecular diagnostic. This genetic counseling deals with the process of helping the people to understand and adapt to the medical, psychological, and familial implication of the genetic contributions to the disease. So today we are going to have listen to the experiences of being a genetic counselor. Mr. Bassam Jamailail, who is a certified genetic counselor working at Alborz Diagnostic, is going to share with us, and he's going to give us his insights and becoming a genetic counselor, and his experiences are very valuable to all the prospective genetic counselors in and out, in Saudi Arabia, and also the people from the Middle East. And I invite Mr. Bassam to share his insights about being a genetic counselor, what kind of experiences he has gathered in the field. Thank you, Bassam.
Thank you, Dr. Noor. Good evening, everyone. My name is Bassam Jamailail. I'm a licensed genetic counselor working at Alborz Diagnostics. Today, I'll be talking about becoming a genetic counselor. Okay, so today we're going to be talking about, I'm going to give a brief introduction into genetic counseling, and then I'm going to talk about the skills or the genetic counseling skills that the counselor need. And lastly, I'm going to end with clinical versus laboratory genetic counseling. So what is genetic counseling? So a genetic counseling is basically, it's a process of communication and education that addresses the concerns relating to the development and transmission of genetic diseases. Genetic counselors are healthcare professionals. They have a graduate degree or a specialized diploma in genetic counseling with experience in medical genetics and counseling. So what do genetic counselors do? We work as members of the healthcare team where we assess the risk of a genetic disorder by researching the family history and evaluating the medical records. We also provide support and information to help a person make a decision about testing. We also, if they have done genetic testing before, we help them in interpretation of the results of the medical test and the data. We also explain the possible treatments or preventive measures that are available, and we discuss reproductive options that are available for them. So the aims of genetic counseling, basically, we aim to provide the family with the complete and accurate information about genetic disorders. We also promote their informed decision when they have to make their own decision when it comes to genetic testing and measures. We also help them in clarifying the family's available options, treatments, and prognosis. We also explain the alternatives to reduce the risk of genetic disorders. We also decrease the incidence of genetic disorders by providing a proper counseling, and we reduce the impact of such disorders on the family. So the genetic counselor should always ensure that the client or the consultant is provided with the information that enables him or her to understand the medical diagnosis and its implications in terms of prognosis and possible treatment or management. They also have to understand the mode of inheritance of that disorder and the risk of developing the disorder or transmitting it, also known as the recurrence risk. We also have to make sure that they understand the choices or the options available in dealing with the risks. It's also very important to note that genetic counseling should include a strong communicative and supportive element. Why? Because those who seek genetic counseling need to be able to make their own fully informed choice or decision without being under pressure or stressed. So, when it comes to genetic counseling, what are the indications of genetic counseling? Sometimes families visit a genetic counselor if they have a family history of a known or a suspected genetic disorder. They can be a carrier of genetic condition. If there is a consanguinity that is in the family and they're worried about that might cause genetic disorders. If during prenatal ultrasound there was found to be a fetal structural anomaly, if also during a prenatal there was an abnormal screening test result, either by traditional serum or by using cell-free DNA, or if there's a recurrent pregnancy loss, or if the patient would like to get more information about genetic testing and genetic disorders. So, what is the role of the genetic counselor? The genetic counselor provides genetic information. It is their counseling skill. So, the counseling skill of the counselor, their ability to empathize with the patient, make them skilled enough to provide the information in a good manner for the patient to understand. The good genetic counselor have many strengths. They always make sure that the patient priority is their top priority, and they always make sure that they deal with the ethical and professional challenges. They provide counseling in a non-directive approach in where they develop a mutual relationship with the patient so that the patient can come up or come with their own informed decision. They the counselors are able to understand the patient from a different point of view than a clinician or a physician, because in counseling there's a mutual relationship that is built between the patient and the counselor. Also, we as counselors we have to assess the client's or the patient needs, the values, and we provide them an individualized counseling session that it fits the needs and the agenda of that specific patient. So, what are the prerequisites to genetic counseling, or how can a genetic counseling session goes by? First of all, we need to have a detailed family history because the family history gives me information about the type of disease that is running in the family. We need to also make sure that we ensure an accurate diagnosis because sometimes when you give a misdiagnosis or a wrong diagnosis, that can affect the family. We need to understand the medical aspects of that disorder, the etiology, the natural history. How is this, the prognosis and the burden of that disease? Also, the inheritance pattern. How is the recurrence risk of this disease? Also, the psychosocial impact of the information that is given on the family or the patient. Also, to understand how this patient views health, disease, and healthcare in their own culture, in their own perceived idea. So, all of that has to be incorporated in the counseling session. So, the information conveyed in a genetic counseling session, it highlights the magnitude of risk, of occurrence of the disease or the recurrence of the disease, how this disease impacts the patient and the family, and sometimes there is a modification that happens to the risk of this disorder, and keep the family updated when it comes to future development in terms of testing or the disease itself. So genetic counseling ethics, it's a very detailed. I'm not going to go into huge detail about the ethics. However, it's very important to always respect the right of the individual when it comes to the genetic counseling. Also, we have to use a non-directive approach, and we have to make sure that the privacy and the autonomy of the individual and family are always protected. So, in short, genetic counseling is about determining the facts, meaning that we need to know the diagnosis, the etiology, the inheritance pattern, the prognosis, the treatment or measurement plan, management plan, and the recurrence risk. And take all this information and transmit it to the patient in a way that is culturally appropriate and understandable. Because if you give the patient information that is very difficult for them to understand, that will not ensure a successful counseling session. Also, we have to make sure that we're supporting their decision. And again, we're being non-directive. So there are two types of genetic counseling. There is something called the prospective genetic counseling and retrospective genetic counseling. Now, when it comes of prospective genetic counseling, it allows for the true prevention of disease, meaning that there is a wider application of now to cover individuals for any particular defect by screening. So we explain the risk if these individuals married each other, for example, of having a disease, or if there is a chance of their child being affected. For example, when it comes to the ما قبل الزواج, فحص ما قبل الزواج, when we talk about sickle cell anemia and thalassemia, where we test couples prior to them having children to see if they're compatible. This is some way, somehow, it can also help in prevention of genetic disorders. The retrospective model, it's now the one that is mostly used in genetic counseling, whereas there is already a disease that is identified in the family and the disorder already occurred in the family and they're coming in for counseling. Okay, so moving along, the steps in genetic counseling. First of all, we gather information. We gather information about the patient, their family history, their medical history, and then we try to reach a diagnosis and come up with a risk assessment on the possibility of transmitting this disease. And then we take all of that and give it to the patient in a way that is for understanding for them. And also we have to do a psychological assessment and counseling because this information is difficult for the patients. And we give them support and discuss them with the options available that they will be able to reach a decision. So there are 5 steps in genetic counseling. First, diagnosis. Now, diagnosis is based on the accurate family history, medical history, examination, and investigations. We'll talk about risk assessment, communication, discussion of options, and long-term contact and support. So the most crucial step is basically establishing the diagnosis, because if it's incorrect, this will give the patient a totally misleading information, and it could impose a tragic consequences on the patient. How do we reach diagnosis? It involves 3 important steps. First, taking the history, then clinical examination, and then appropriate investigations. So risk assessment, it can be very easy, depending on the modes of inheritance that we all know. We have the 4 main modes of inheritance, which are autosomal dominant, autosomal recessive, X-linked dominant, X-linked recessive. Communicating the recurrence risk of such disorders can be very straightforward if we have clear information about the disease. However, sometimes this can be an issue because sometimes you have variable age of onset, such factors such as variable age of onset, reduced penetrance, a variant of unknown significance from a genetic test. All of these can alter the recurrence risk of the disease, so it can change how the person understand the risk. So it's always important to know that the recurrence risk should be quantified, qualified, and placed in the context. So when I'm talking to the patient about the recurrence risk, I have to be very clear. For example, if it's an autosomal recessive disorder, I have to mention that there is a 25% chance recurrence risk. I have to put it into their own perspective for them to understand it. And also, I have to take into consideration that a risk from my point of view is different from the patient point of view. So I have to make sure that the patients understand One of the issues that we're facing is that in genetic counseling, sometimes you would say to parents that, oh, there is a 25% chance of having a child affected with autosomal recessive. They would take it at that, oh, the first child will be, if it's affected, the other three will be fine. So you have to place it into their context and explain that for each pregnancy, there is a chance of having a child affected. When we talk to patients about their options, we have to give them the information they need, all the information in a clear way so that they can make their own fully informed decision. We need to have an open discussion about reproductive options, the choices they have, the available options for them. Also, we need to talk about alternative options such as PGD, which is pre-implantation genetic diagnosis, and in vitro fertilization. All of these options needs to be discussed with the patient so they can come up with their own decision. Also, we need to give them a full detailed review of the techniques, its limitations, and the methods being used, how it's going to be performed for them to come to this decision. If you don't mention all of this information, sometimes it will be difficult for the patient to make their decision. Okay, communication. Communication is very important. We all know that communication is a two-way process. We as counselors, we provide the information and the patients are the one that receive this information. So we have to make sure that the information given, we have to, we have to, when we tailor the information given, to take into account the fears that the patient may have or what kind of thoughts the patient have. And the information must be presented in a clear, very appropriate manner. Individuals, it's a very studied fact that individuals or couples, they will be extremely upset, or they would have a lot of psychological distress when they are aware of genetic test disorder. So you are faced as a counselor with a patient that has a lot of psychological and emotional factors that will influence your counseling session. So you have to make sure your setting or your counseling setting is private, it's quiet, it's give them the time to process the information you just gave them. So sometimes it can be very difficult for as a counselor to deliver you the information to the patient because of the shock that the patient is going through. So you have to make sure that sometimes you would follow up with the patient in a different appointment so that the information you give is precise and it's accurate and it's fully absorbed by the patient. Now, there's a lot of research that is suggesting a directive approach rather than a non-directive approach when it comes to counseling. However, it's a universal agreement that we should not coerce or attempt to direct the patient to take a specific course of action. The patient has to be satisfied with their own decision. They have to come with their own decision. Also, as a counselor, you should not be judgmental of the decision that the patient made. You guide the patient, however, you don't impose or try to direct. Sometimes you would be sometimes patient would ask you a question, tell you, okay, what would you do if you were placed in my position? And they teach us a lot about this a lot in counseling. However, every person is different. Every person has different circumstances, different culture, different environmental effects. So if you would answer based on your own opinion, maybe your opinion is different from your lifestyle setting is different than the patient. So that can actually cause the patient to regret the decision later on, or it would say, you told me to do this. So that's why we always use the non-directive approach. So you always have to remember that the patient is the one who's going to live with the consequences of the decision, not you. Okay, so when we talk about in the counseling setting, what we do usually is we start with obtaining the family history. Now, the family history is very important because it gives you a lot of ideas about the patient, their past, their future. It can help you guide you into the appropriate testing based on the information you gather from the family history. The family history can give you an idea also about the diseases that might be running in the family, such as heart diseases, cancer, diabetes, and so on. All of these can be incorporated. And also it can help you in early identification of the at-risk individuals so that you can take preventive measures early on. So how to take a family history or a medical history? First, when we talk about, we're going to talk about pedigrees, but in a few slides, we should always talk about 3 generations. So this is when it's a standard when we take a pedigree or a family tree. So we start by asking questions about their history. For example, the questions can be including like the names and the birth dates, the ages of these individuals, their ethnic background, the health status, if they have any medical condition, and at what age they were diagnosed. We also have to talk about if there is any death in the family, what the cause of death and the age of death of each deceased family member. And we also have to talk about the pregnancy, if there is any miscarriages, neonatal deaths, all of that needs to be incorporated into the family history because all this information is very valuable for a counselor. So a pedigree, it's a shorthand system that we record patient family information with. We usually started with the person who came to the clinic. We call this the index case or the proband, and we always indicate the position using an arrow. Um, I will just simply talk about the symbols that we have in the pedigree. So if we see a square that means it's a male, whereas a circle is female. Also, the lines indicate the relationship. So when we see a horizontal line connecting two people, so for example, this line, the horizontal one, it indicates a mating relationship, a breeding couple. Whereas if I use a line that is vertical like this vertical line indicates parents to children. So it connects parents to children. If there's a diagonal line like this one over here, this diagonal line, it means disease. The person has died, okay? It means death. So these lines are important when you're drawing a family pedigree because it will show you the relationships and how each person is connected. Now, when it comes to shading or the color of the pedigree, a shaded or a colored square means, like, for example, an affected male, the person is affected or has the trait, whereas a clear one indicates that this person does not carry the trait or it's normal or healthy. Sometimes you would see something that looks like this, either a dot or it's half colored. This means that the person either carry a gene or they're carrier of a specific mutation, for example, or they're not affected. However, they're carriers. They only have one copy of a mutation. Okay. Now, also in the pedigrees, it's very important to indicate the generations. So generations are highlighted by Roman numerals. Okay, so this is generation 1, generation 2, generation 3. And we highlight the individuals using numbers. So here I have generation 1, individual 1, generation 1, individual 2, generation 1, individual 3. So the numbers indicate their location. It comes up with the age and the generation and the birth order. So for example, here in generation 1, person 1 died of heart failure. In this one, person 3 in generation 1, the cause of death is unknown. So this is type of the thing that you might face in the counseling clinic. When you're drawing the pedigree, they might tell you, oh, we don't know the cause of death, or this person died because of a heart attack, that person died of cancer. So all of these information you have to incorporate in your pedigree. Okay. So the analysis of the family history. So when we analyze family history, it's very important to determine if this trait is dominant or recessive. We would know that if the trait is available in every other generation, we know it's recessive. If it's in every generation, it is dominant. Here we have an example of an autosomal dominant pedigree. So this is an autosomal dominant disorder. So we can see that the disease is basically available in every generation. Other factors do affect the autosomal dominant inheritance, but I'm not going to get into too much detail. This is an autosomal recessive pedigree where the disease is showed in its skip generation 1, skip generation 2, skip generation 3, and then appeared in generation 4. So the recessive trait tend to skip generations. Then we have to also determine if the we have to determine if the trait is autosomal or if it's sex-linked. Now, if it affects both the males and females equally, we know this is autosomal, meaning that when we look at chromosomes, we have 23 chromosomes, 46 total chromosomes, 23 from the father, 23 from the mother. We have 22 autosomes. So the autosomes are from chromosome 1 to 22. So if it's mutations on there, we call it autosomal, whereas if it's on the X or Y chromosome, we call it sex-linked. And if the trait affects one sex more than the other, we know that it's sex-linked. So a sex-linked disorder is carried on the X chromosome, for example. The females carry the trait, and they transmit this trait to their sons who are affected. Because males have only one X chromosome, so if the male got the X chromosome that is affected, they will be affected. Females get the traits from either an affected father or a carrier affected mother. And the affected males, transmit the X to their daughters, and they give their sons the Y chromosome. So this is an example of an X-linked recessive pedigree. We can see that females tend to be carriers. There are other factors where females who are affected with an X-linked disorder. Again, I'm not going to get into too much detail about this because it has the factor that we need to explore. But just in general, X-linked recessive pedigree, sometimes a female will manifest a disorder if there's any X inactivation or if there's a translocation, and among other factors. Okay, so what are the important qualities for counselors? As counselors, we have to respect and empathize with the patient or the client. We need to have great communication skills. And I'm going to talk about communication in a few slides. Also, we have to accept that the values and beliefs of other person that is different from our own. So you will meet a lot of people who have different values or different beliefs than you. So as a counselor, you need to be able to distinguish between and accept that other people have different values and beliefs. And we should have an attitude, an impartial attitude towards all clients. We cannot treat clients with disrespect or depending on how we feel. We also should be comfortable discussing personal issues, and we support them in making informed decisions. Also, we need to have the technical knowledge and skills to carry out a counseling session. In genetic counseling, you have to have a good, accurate information about medical genetics. Also, your counseling skills must be a lot of practice will help you develop good counseling skills. Sometimes gender does affect the client-counsel interaction. Gender is basically the role prescribed for men and women in cultural society. Sometimes when the sex of the counselor or the gender of the counselor and provider is different, it can be very difficult to discuss sensitive issues or uncomfortable having clinical procedure. Also, it's very important that when you're counseling a couple, you need to give equal attention to both the partners. You cannot just focus on one partner and ignore the other. Both of them are assess their needs, both of them. Okay, what are the characteristics of effective counseling session? It needs to be client-centered, so I have to assess the agenda and the needs of the client and answer the questions of the client So at the beginning of the counseling session, it's very important to understand why is the patient here? What did he hear? Why was he referred? Or what is he looking for? What question does he have? The counseling session should be interactive between you, and so you need to pay attention and also speak when it's the appropriate time. It should always be private and confidential. So the things that are discussed in the counseling session should be confidential and not be shared. It also should be individualized. For example, your counseling should be tailored to that specific needs of that specific patient. You cannot counsel all the patients in the same way because each person is different, as we said. Also, as counselors, we need to adapt to the challenging conditions that may arise. Sometimes you will be faced with difficult situations because of the psychological distress or certain things that triggers the patient. So you have to adapt and be able to handle these challenging conditions. So what are the tools for effective counseling? We have communication skills and technical information. So effective communication will enable the client or the patients to feel more comfortable talking about their needs. So we need to always have active listening and the ability to use simple language. Active listening comes in the form of verbal or nonverbal communication. So nonverbal is basically what is observed and sensed, and verbal is what is said and heard. So when you talk to the patient, you need to have an appropriate tone of voice. For example, you cannot be screaming at the patient or speaking in a way that the patient can't hear you. You need to give verbal encouragement. So whenever the verbal, you need to give verbal encouragement whenever you're talking to the patient. Also, you need to ask questions if you don't understand or if the patient says something, you need to ask questions to gather that information. And you need to paraphrase and reflect what the patient has said. So that gives the patient an idea that you understood what he said when you paraphrase it in your own words. The nonverbal communication comes in paying full attention. You're actively listening to the patient as they're speaking. You're using facial expression that shows the patient that you're interested or that you are actually listening to them rather than being bored or showing them that you're not interested. Also, you need to nod your head or use encouraging gestures for them to talk and be able to share information with you. Okay, clear and simple language. When we talk to patients, the medical terminology needs to be eliminated in a way that the patient needs to understand what you're saying. If you come into the patient and tell them, "Oh, we discovered the mutation," and sometimes the patient will be lost because they don't understand what you're saying. So you need to improve your communication by using clear and simple language. You need to prevent any misunderstanding by trying to eliminate medical jargons as much as possible. You need to avoid any confusion that the patient may have. Practice and counseling patients will give you will enable you to use clear, simple language. With time, with seeing many patients, you'll be able to develop this skill. So before I'll just talk into a brief about laboratory versus clinical genetic counselors. So laboratory genetic counselors are totally different than clinical genetic counselors in a way that as a laboratory genetic counselor, you're actually not interacting with the patient as much. You're interacting with physicians. So as laboratory genetic counselors, we advise physicians and others who have inquiries about genetic testing about what is the most appropriate genetic testing to be done for their case. So, for example, a physician might call you that they need to do a patient, they saw a patient who has a specific feature and they want to do genetic testing. So your role as a laboratory genetic counselor is to guide this physician into the best appropriate genetic testing. Once the genetic testing result is done, you interpret this result to the physician and you can write a report about the result. Sometimes you might see patients, but it's minimal compared to a clinical genetic counselor. We also provide education to healthcare professionals about genetics and or genetic testing. So we usually help in developing of a pamphlet. We help in the development of marketing techniques or about genetic testing. We sit and talk to physicians about new advancement in genetic tests and so on. However, a clinical genetic counselor is different. You can see a clinical genetic counselor that works in a prenatal clinic, in a pediatric clinic, in an adult genetic clinic, in a cancer clinic, and so on. Their role is different. They're interacting with patient because they're actually providing information to the patient. Whereas in the lab, we are more of focused on the physician themselves and the healthcare providers. So as a clinical genetic counselor, you would, for example, in a prenatal setting, if a couple is planning on pregnancy, couple having a high risk of having a baby with a genetic condition, or if they have a couple that is facing a lot of pregnancy losses, among other issues, they might come in a prenatal genetic counselor and they discuss their options. In pediatric setting, basically you provide counseling services to parents, families, and children who have been evaluated for genetic conditions. In the adult genetic clinic, you provide the services to individuals with conditions such as cancer, cardiovascular disease, Huntington and Alzheimer's, and so on. So a genetic counselor for the clinic will differ from the lab in terms of the interaction with the patient. Also, as a lab genetic counselor, you're more of all the clinical information. You have to make sure, as in the clinical genetic counsel, both have to make sure that the clinical information they have are very clear because it's all require an appropriate testing. So if you have missed clinical information, that can affect the type of testing that you will do or the results. So the only difference I would say between the two is in terms of patient contact. Clinical genetic counselors have more exposure, as we said, to the patients, whereas the lab genetic counselors are mostly talking to physicians. In Al Burj, right now, I am working as a laboratory genetic counselor, where I'm seeing, I talk to physicians about genetic tests. If they have any questions about the appropriate genetic testing, I would be the person they contact. I make sure that their request forms for genetic testing is completed accordingly. And I would advise if they have any questions about if there is, for example, if they need more information about a specific test, I would advise them about what is genetic test, the knowledge, and sometimes you would actually talk to physicians about choosing the appropriate test. For example, a physician would choose a test and then you would suggest another test that yield better results. So in conclusion, genetic counseling, basically it enables the couples or affected individuals to make decisions about future pregnancies. It also aids them in education and coping about genetic disorders. And genetic counseling should be done in an objective manner with a focus on the personal choice of the individual involved. So the most important part of genetic counseling is that the personal choice of the individual. Uh, your role as a counselor is basically to guide, whereas the decision and has to come from the patient themselves. We want to tell you that we're going to have an upcoming workshop. This one is going to be different. We're going to be talking about genetic counseling in theory and practice. It will be a more detailed genetic counseling workshop that is scheduled on the 14th and the 15th of September. And it's going to be a virtual workshop. We will send, we're going to send out the advertisements very soon, inshallah. Thank you. And if you have any questions.
Thank you, Mr. Bassam, for informative lectures. So, any questions from the audience?
Does anyone have any questions?
There's questions here.
There is a question from Mujahid. Is there any way to inform the patient? What is it? What do you mean inform the patient about what? So to inform about a possible inherited disease. So when we talk to patients, usually now what we're seeing in the clinic, patients do come in that after they have an affected child, for example. I'm talking from my own experience. So basically, we would sit and try to understand that we need to do genetic testing to understand what kind of disease they have. So we need to make sure that we have a clear picture of the disorder before in talking to them. So when they come into the clinic, they would sit with us first. We'll take a clear history, clear medical records, a full understanding of everything, and then we would guide about the best testing option. And after that, so we do pre-test counseling and post-test counseling to discuss the results. So this is what we can do. I don't know if I answered your question or this is what you're looking for.
Mr. Bassam, there is another question. Does the pharmacist have role in the counseling process?
The pharmacist. Right now, we do have a lot of pharmacogenomics studies that now basically some mutations do affect the individual's disease, medication interaction. So they, in some disorders, maybe there is a role that we need to talk with the pharmacist. Yes.
There is a question, but I'm not clear about it. Any person have a certificate for genetics or biotechnology can be a genetic counselor?
Genetic counseling, it's a master's program. So if you have a bachelor's degree in genetics, or you should be able to apply to the program. You can apply to the program and become a genetic counselor.
Okay. Can genetic disorder be treated in some way before pregnancy?
Treatments of genetic disorders is still under research because there's not a lot of treatments available at the moment. But we're hoping one day that treatments will start to develop, especially now with the research and all of that. We're hopeful for that.
Okay. So what we do if the patient ashamed to say anything about their problem?
So when it comes to genetic disorders, parents or patients usually tend to have a lot of psychological issues. One of them is shame because they feel the society, they feel a lot of things that surround them, especially that the societal norms is different. Especially, for example, if you think of a child with Down syndrome or a child with mental disability, the society tend to have perceived ideas. So in the counseling session, we usually try our best to handle the psychological distress by talking to the patient and trying to understand their fear and to provide them with the support they need.
Okay. The next question is parental genetic counseling under the clinical section?
Yes, the prenatal genetic counseling is it's usually under the fetal-maternal clinic, and they work in hand with the physician or the OP-GYN, where they are referred to counseling, and if there is a mutation identified or there's a family that has a specific disorder. So yes, it is under the clinical section.
Okay, there is another questions. Are all the tests accurate and to which degree?
In genetic testing, we cannot say that all the tests are accurate. Sometimes it's very, there's still advancement in genetic tests. So it depends about the accuracy of the test. So I would not say they're totally accurate, but for example, whole exome, whole exome now is being used as a standard test. The it still does not cover the entire genome, so there's a lot of things that are missed. So the degree of which genetic tests are accurate is still under study.
Okay. Do you do genetic counseling to epidermolysis patient at Alborg lab?
You can contact us, yes, and we can arrange for that.
Okay. How do you handle situation where a young patient wants to get tested, but their parents refuse?
Well, this is an ethical question. First, how old is the patient? Are they of an age where they're aware of their status? There's many factors that play a role. Are they of age where their guardianship are no longer involved in their life? So there's many other things that you need to pinpoint in questions just like that.
Okay. Do we enroll patients in a clinical trial if they have any interesting grades order only in Saudi Arabia?
Can you repeat that?
Do we enroll patients in a clinical trial if they have an interesting rare disease only in Saudi Arabia? I
I'm
think
not
yeah,
aware.
I think she mentioned about if there any rare disease in Saudi Arabia, we can do a clinical trial for them.
I'm not sure of that, to be honest.
Yeah. Okay. What about a bachelor degree in general biology? When you talk about counseling, if that's anything.
Bachelor's degree in general biology here in Saudi, it's different because the program in King Abdulaziz University only accepts, I think, microbiology and genetics and other applied medical sciences. But I think Al Faisal University might have this option.
Okay, can we make it more easy for those who are willing to get informed before the pregnancy?
I wish that happens. I wish that counseling is, for example, in فحص ما قبل الزواج, I wish that we can expand this to include genetic counseling services so that people can have an idea prior to having children about their status.
Okay, can you recommend a specific diploma in order to be a genetic counselor or only MD?
You don't need to be a medical doctor to get a genetic counseling degree. You can have a bachelor's in biology, bachelor in genetics, applied medical sciences. You need to check King Abdulaziz University website and Al Faisal University, both of them. They have the listed programs on there.
Okay, we have take maybe two or three more questions, then we have to close up this webinar. So can one-shot therapy treat infants before they are born?
You mean the CRISPR?
I think yes, as a gene therapy method.
The gene therapy, now a lot of studies are being done on the gene therapy. We're hoping one day in the future that this can be utilized to eliminate a lot of genetic disorders.
Okay, should I choose clinical or laboratory genetic counselor from your view, Mr. Bassam?
Well, it depends on your case. For example, if you love interacting with patients and because the lab setting for me is different. In a lab, I don't talk to patients, it's very minimal. But if you are the one who like to talk to patients and because in the lab, you'll be more dealing with tests and physicians compared to the clinical, you had the advantage of actually talking to a patient. So there is an advantage and disadvantage to both of them, but it's again up to your preference. For me, I love both, so I wouldn't mind working in a clinic or a lab because both are different and both have different advantages. One advantage I would say for the lab is the amount of genetic disorders that I'm exposed to, because with all the reports that you see, you're learning something new every day.
Okay. I'm not sure what about Sheikh said. I'm a microbiologist. How can I share my experience? So what exactly you want?
What is your experience? Yeah.
Yes. You can, if you talk about, if you want to present your experience through Al-Burj, so you can contact us through email or Telegram.
Yeah.
Yeah. So another question, I want to send this lecture to friend. She registered but was requested a passport. Okay, you will see this lecture and the YouTube channel for Al-Burj. So maybe after 2 or 3 days, it will be published for all the audience. So just follow the YouTube channel and you find it as it is.
Okay.
Thank you. So thank you, Mr. Bassam, for this wonderful talk. And as Mr. Bassam said, we will be having another counseling workshop and we will send out the registration details soon. So we hope this workshop will be benefit, and we hope to see you again with other free webinars or other paid workshops. So thank you all.
Thank you. Thank you, and hope to see you again in our next workshop.
Yeah, inshallah. Thank you, Mr. Bassam.
Thank you.